This is the MyHeart.net podcast. This show is produced by Dr. Philip Johnson in conjunction with VitalEngine.com. Please welcome your host, Dr. Alain Bouchard, a cardiology specialist of Birmingham, Alabama, at St. Vincent's Medical Center, part of Ascension.
Welcome to MyHeart.net series on healthy lifestyle. We'll discuss today with Dr. Martha Gulati the effect of cigarette smoking. The title of the episode is Clearing the Air, Understanding the Dangers of Smoking and Vaping, and the Strategies for Quitting. Here's Dr. Gulati. All right, well, let's get started. We have probably 5 lifestyle factors we need to talk about. And of course, the big one is smoking because it's been there for quite a while. And it's probably one of the most modifiable as well as incredible repercussion on our health. So what's bad about smoking, Martha? And then, let's talk about how do we quit.
Yeah, and this is the one thing that we as physicians, I would say, do very poorly. We don't talk a lot about it with our patients. We're not good at helping our patients quit. And yet it is the leading cause of cardiovascular disease. When you smoke, you have such a greater risk of developing cardiovascular disease. And why that is there's damage to the arteries that occurs as a result of smoking. An increase also in atherosclerosis as a result. There's changes to your lipid profile or your cholesterol, particularly the good cholesterol seems predominantly affected by people who smoke cigarettes. So this is something that, at every visit, for patients who smoke, I'll just tell you, I know it's uncomfortable, but it's something that we should be talking about because your physicians can really help you quit smoking. The problem is often we don't spend that much time. We just say the words, you should quit smoking.
Yeah, it's easy to say, not easy to do,
No.
when we look at what the smokers take with each puff of cigarette, I mean, the nicotine, not only nicotine in there's about 70,000 chemicals, 70 of which cause cancer. So it's really incredible that, the damage that you can see, occurring with smoking. And so how do we quit, Martha? I mean, it's, the patient want to ask you, let's have a conversation about quitting. I mean, I'm interested in quitting. What should I do?
Well, let's hope that it starts if the patient initiates the conversation, but we as providers feel like we should be asking. And we put out a document actually in 2018 that really gave a pathway and sort of advice for our medical community, because really nothing had been put out in years really to help guide physicians. But it should start with us always asking our patients, do you smoke? Or if you were a former smoker, just also asking if you've restarted smoking. The next step is for us to actually assess how much you smoke and to really know the number of cigarettes you smoke a day and the time that it takes you to smoke. Well, time meaning your first cigarette. So does it happen right away when you wake up? Tells us a little bit about your addiction to nicotine versus somebody who can wait longer, and that helps decide right medications as well. And then if people have quit, we should be talking about what was your prior experience in quitting so that we know what might have partially worked or what failed for you. The next step for us as physicians is for us to give you advice about quitting and offering and connecting you to treatment. And because there's a lot of treatment and we can go through that, but we need to do more than just say quit smoking. We need to give the counseling and we need to offer that up front and see if you as the patient are ready to quit, like if you accept that advice or if you decline it. It's okay if you're not ready to quit smoking, but we should bring it up at every visit because you never know, we need you to be engaged to quit, but we never know what will be the switch on moment for that individual. And when they know that a physician's engaged with your ability to quit smoking and want to help you, that can sometimes motivate you to do it. You realize that there's a reason they're asking you always about it, and that they actually have therapy that maybe you've not tried before. So that's my approach as a physician. And I think, ultimately there's a bunch of questions we ask about the readiness of somebody being willing to quit, and all these different resources that we have. But the readiness is the biggest thing, I think, that helps us get to know if you're really, if this is the time to quit.
Well, I think that's very important because, I mean, obviously it's never too late to stop. And it seems like the effect of smoking cessation starts immediately. I mean, you have a lower blood pressure as well as lower heart rate just within a few hours of stopping your cigarette smoking. And within a year, you halve your risk of heart disease, which is pretty powerful. So it seems like there is kind of a physiological, a nicotine dependence, and then there's the behavioral, portion of the smoking and smoking cessation. How do we actually help the patient with their nicotine dependence? I mean, what kind of formula do you use? I mean, there's all kinds of, nicotine, product out there. Some are short acting, some long acting, and there's even some other, compound that are being used, like Wellbutrin. I guess we'll talk about that. What is the formula that has worked well for you that we could use for our patients?
Well, I think, every one of them has a role. There is the nicotine replacements, of which we have many different forms. We have patches, we have gums, we have lozenges, we have a nasal spray, and we have an oral inhaler. So they all have, they all have an expense with it, unfortunately, because depending on your insurance, it's unlikely to be covered unless, I will tell you, sometimes your state or where you work might do specific things because they want to help you quit smoking. But nicotine replacement is certainly part of it. And then the other part is the pharmacologic side. The bupropion or Chantix is another drug that we use. Bupropion, people know as Zyban or Wellbutrin, either one, they're the same thing. And, for everyone, it might be a little bit different. My preference is really using Chantix first and foremost, but there's some things that you have to know about both drugs. And I think that, again, everybody, you have to work with that individual to understand, why they might have a problem with something or another. For example, things like Wellbutrin, if people have a history of seizures, you would never use that drug. Another example, Chantix, it's great if people don't eat a lot, though. Like if there's somebody who just doesn't eat a lot of food, although sometimes that changes when they're trying to quit smoking, they can get a lot more nausea with it. If they have any renal issues as well, there you have to at least be careful about the dosing. But otherwise, I think that Chantix is usually the drug that I like to start with. But for some patients, they don't want to take those. And so they, I understand that. So then we need to work with them with the nicotine replacement in the form that they feel comfortable with. I find that the gum works well, or the lozenges, because there's something very connecting about the oral side of it, replacing the oral portion of the cigarette. And I find more success with that than using the patch, to be honest with you. I haven't used the sprays often, the inhaler or the sprays. Often the cost has been the biggest prohibitive side of those things. But again, we did something novel when I was at Ohio State University. We were able to get our government our state government to pay for the replacement. And it was a short couple of years, but while we had it, it was a great incentive because people didn't need to pay for these. And we had a team, a smoking cessation team that worked with me, a bunch of pharmacists that were fantastic. And that helped because it helped with the close contact that you need. I think when someone's quitting smoking, one of the hardest parts is keeping on track and feeling like you have that support system both at home but externally, being accountable, and having a team really made a difference. So that's another part of smoking cessation that people don't really talk about, but it is about creating that support system, which includes your family, and sometimes means that your partner may need to quit smoking too, which is not always easy. They may not be motivated even when you're motivated. And secondhand smoking is part of the sort of risk equation that we say puts you at risk for potentially rebounding or going back to cigarettes, even when you're trying and getting very successful with quitting. If you're in a home that there's still other cigarettes, all the things that are maybe tempting are physically present to you, and it makes it a little bit harder. The other part of that equation, though, like I said, is behavioral support. And that, I would say, is probably our weakest link because we don't always have that in our communities where we can provide that. If you're lucky, like when we started a smoking cessation clinic, we were able to provide all of that, the behavioral and psychological part of the treatment and and like I said, the very close follow-up. And it's not always possible for your primary care physician or your cardiologist to have those things in place. So really look at your own health insurance because they may offer that in some way to you and you may not be aware of it. It may be, now that we're doing so many things virtual, it may be a virtual option, but to connect with somebody is probably a big part of this equation that people will need to be successful about quitting. So, and then you asked me, I think you asked me something else, and I might have gone a little sidetrack on you. I apologize.
So let's say, for example, you have a patient that you want to start. He's interested in stopping, smoking. Yeah. You'll use, for example, either something like Chantix or a long-acting kind of nicotine patch, for example.
Yeah. So
one or the other.
It depends where I'm meeting them. So as an outpatient, when people are, after we meet them after a heart attack, I have a little different. I start them there on a nicotine patch to help relieve their withdrawal. And then on discharge, I would ask them, do they want to continue with the nicotine replacement therapy, or we can consider Chantix. If it's outpatient, I definitely start usually with Chantix, but sometimes I will do it with some nicotine replacement. Those are my first line drugs, depending on the location. My next choice will be things like Wellbutrin or a single nicotine replacement by itself. And then my third line drug is things like nortriptyline, which I don't use a lot of, but, and it's not actually FDA approved for smoking cessation, but it certainly is an option that even our scientific statement that came out would be that also their recommendation as well. So, and then the combination of drugs together can be the way to help people. If they failed on one of those, I might suggest we use a combination with the nicotine replacement, or even sometimes Chantix with Wellbutrin can be a good combination that can be effective.
And so you could use, for example, a nicotine patch combined with more of a short-acting, like a nicotine gum or lozenge or even a spray, just as needed, or a combination of Chantix and the short-acting nicotine replacement. That kind of combination works pretty good.
Yeah.
Well, that's wonderful. It's still a challenge. And as you said, I think to have the support in place is very, very important. Now, you know that we're going to have to talk a little bit about vaping.
Yeah.
The very controversial. I have another good friend in Canada, Dr. Martin Junot at the Montreal Heart Institute, and he's not so much against vaping because, he's seen a lot of smokers kicking the habit. Of course, now they're vaping and sometimes with a little bit of nicotine or even without nicotine. There was some bad publicity, of course, about vaping, particularly when it was associated or had some THC in it. It caused some pulmonary disease. It caused even some death. And there's also the concern that you're trading, one disease or one habit for another. In the study, I think published in the New England a year later, 80% of the patients were still vaping, versus only 10% were using nicotine replacement. Certainly, and I think we can say that in the young adults, in the youth, there's been a decrease in smoking, from 2011 to 2019, for example, number of smokers have gone from 15% to barely 6%. Of course, the vaping, now you have, these young kids, about 20 to 30% now are vaping, and who knows what's in it. So.
That's, I think, our biggest problem. Like, it's funny, prior to COVID, we were all worried about e-cigarettes, and then our focus quickly changed, right? Because our world changed so dramatically. But we were talking a lot about these e-cigarettes and, the risks, and even our recommendations aren't really, these devices are not approved by the FDA as a smoking cessation product. But there is some evidence that in people that are heavy smokers, that e-cigarettes can reduce, especially when they had heart disease, as a study out of Montreal showed, that they were helpful to get people to quit. But the problem was really, did we just substitute one form of nicotine for another form? But there can, I think that this is why we need the FDA more involved in the development of these devices, because of all the chemicals and other things that we can't regulate in these things that are being sold, makes it very hard to get an effective delivery. To me, it's in some ways a physical form similar to a cigarette, but that you could deliver nicotine, which is what we're doing with all the nicotine replacement items. But this is so physically like a cigarette that you do imagine that it can be more somehow soothing to somebody who's trying to quit, and even be used in a similar way and hopefully lower the doses. But we can't even control the amount of nicotine in these devices, which makes them a little problematic. For the younger people, what the biggest problem with these e-cigarettes to me is that, yes, younger people and people in general, the cigarette smoking is going down, which is great. And that's a wonderful thing. But for younger people, they are substituting, unfortunately, with, they're using way more. I think the statistic right now is that 1 in 5 high school students are using vaping in some format. And so that to me is an epidemic. I mean, that is something we got to be concerned about when we don't even know what's in these products. And then it's very hard. Like you said, there's people that are using these long term. What is that? We're creating addiction, especially to kids. And people that say that these e-cigarettes aren't being made for children, then why are they putting flavors in these products that are really designed and targeted to children? And so that's where the whole American Heart Association, came out. I guess it was in late 2019, where the anti-vaping movement was to, try to get kids to understand that this was really targeting them and getting them addicted to a substance, which we just shouldn't want. So I think the conversation isn't over about e-cigarettes. I think if it could be a really good delivery form, if we could control what's in them and know what's in them.
Very good point. Well, I think this is the chapter of smoking. That's a big one. Fortunately, we're seeing less and less, smokers. And, I guess all this effort that has been put together over the last 10 to 20 years is paying off to some extent. It's not over yet, but, it's progressing very nicely. Quitting the habit of smoking is not an easy task, but can be achieved. It's important to have a discussion with your physician. We can prevent heart attack and stroke. In our next episode, we'll discuss the importance of the obesity pandemic and the problem with weight management.
To learn more from our team of cardiologists, please visit us at MyHeart.net. You can also follow us on social media by searching MyHeart.net on Facebook and Twitter. And be sure to subscribe to this podcast so you don't miss our next episode.